Going to talk about the health of the child, and all of my information was received from Health Education Elementary and Middle School Application 7th edition by Susan K. Teljahan. So let's start with what is health. Usually when people think of health, they associate it with a child's or person's physical well-being. How do they look? How are they dressed? How is their hair? Are they dirty? Do they have cuts, scrapes, bruises, things of that nature? But actually health is related to physical as well as cognitive, social, emotional, sexual, and spiritual health. Even with all of those domains that are affecting health, there are some issues with implementing health education in the school system. And the most common one is time restraints, as well as parents' unwillingness, teachers feeling uneasy, and religious aspects. You want students to have a sense that they belong at the school, and a major way to do that is to give them a sense of school connectedness. That is where they feel like they are a part of the school, they feel like they're close with the teacher, and if there's a good school connectedness, then students are much less likely to fail classes and miss school a lot. Mood disorders in schools are fairly common, and sometimes they can be a sign that something else isn't right. But things such as acting out or inattentiveness can be things like ADHD or other types of mental disorders. But children who come from families with mood disorders are at a much higher risk to develop them themselves because sometimes they can be genetic. And if the teacher notices any sort of problem with children and the mood, then they should address the parent as well as the social worker. Another one of the major concerns of school systems today is children are overweight or obese. And this is a huge epidemic in our day and age. Poor lifestyle choices can lead to disease, poor test scores, and poor attendance. And unfortunately, nutrition education is dropping because there's an emphasis on things such as math and reading. But even if there are higher emphasis on math, there can be nutrition education implemented inside of a math lesson, such as having children seriate only the healthy food in a set that has healthy and unhealthy food. So that way they can see things that are healthy and unhealthy. Unfortunately, another thing that is being cut is physical activity such as recess time in schools because there's a higher emphasis on education, and a lot of places believe that physical activity isn't needed, and unfortunately it is, since physical activity can affect a mental domain and make children less likely to do well on tests. Having physical activity can decrease the likelihood of chronic diseases, and children the ages of 6 to 17 should engage in at least an hour of activity a day. Now, even if there is no PE time or recess time in a school, every lesson can have physical activity implemented into it somehow, even if it's just running back and forth and do running math problems or something of that nature. Safety is a pretty big issue affecting schools and children today, and the unintentional safety risk is maybe a little higher. Unfortunately, the leading cause of death in young people is motorcycle accidents, but there are also automobile accidents that could lead to fatalities because children aren't properly restrained or they are sitting in the front seat when they are too young. Thankfully, unintentional accidents at school are fairly uncommon, but things such as playground safety should be enforced, and most unintentional injuries are preventable. Students need to understand that personal health is also a major concern for their physical well-being, and they should be their own advocates. They should be able to say, no, this isn't gonna hurt, or this is going to hurt me, this isn't going to help me if they're in a negative situation. They need to know the difference between what's healthy and what's unhealthy, not with just food, but with sleep, diseases, UV rays, hygiene, as well as sexually transmitted diseases. UV rays can be like even tanning too much, which a lot of older students do now, can be hurtful to a child's well-being. So children need to learn to say no. Just like there's unintentional injury, there is intentional injury, which is a risk to students. Now, this can be things such as sexual abuse or bullying, so students need to be taught at a young age the difference between a good touch and a bad touch. And when children are exposed to violence in their home, such as parents arguing or being physical with each other, then they learn that this is okay behavior, and they will often do the same thing to other people in their lives. A lot of times, children will display signs of sexual abuse as well as any other type of abuse, but it may not be apparent immediately. So a teacher should know what is normal and what isn't normal with each student in their class. Unfortunately, another thing that educators today have to face are their children using tobacco, because children who use tobacco are less likely to do well in school and also have a much higher dropout rate. But a lot of schools have a tobacco-free policy in effect where anybody who is near the school or associated with the school cannot use tobacco anywhere, even on the school buses, school events, or anywhere that is associated with the school. And unfortunately, tobacco use can begin as early as 12 years old. That is still an elementary school student. So tobacco prevention needs to start very early, and children must know the short-term effects of using tobacco. And while it can start at 12, it usually begins around the age of 16. And in the United States, it is illegal for anyone under the age of 18 to purchase cigarettes. So there is some sort of enabler, and usually it is not family members, but people that they hang around with who are older than them that buy cigarettes. So they need to learn what is healthy and unhealthy and to stay away from people who are using tobacco. Just like with tobacco use, alcohol and drug use also have a much higher dropout rate with students who are using them. So students should be taught at a young age what is appropriate and what is not appropriate, such as abusing alcohol, even if you are 21 or older, and drug use at all should really be frowned upon and taught. Our children should be taught that that is not healthy for them. Now, children who have friends that use alcohol or drugs are at a much higher risk to use themselves, as well as if they are exposed in their families to alcoholism as a child. And alcoholism and drug use can also be genetic. Sexual health is often the most controversial education in school systems because a lot of parents or even churches don't want it being taught to young students or students at all, because children should just be abstinent. But in reality, there's a much higher risk of premarital sex now than there was even 50 years ago. So children must learn about it, and it should start at a very young age. Not necessarily about sex in general, but teaching children that their body parts are different from the other gender's body parts and things of that nature. A lot of times it's better to start in preschool with sexual education, such as just teaching children about their own bodies and then work to the other gender's body. And in the older grades, they should be taught that abstinence is the best way to prevent themselves from having diseases or getting pregnant and things of that nature. And lastly, children should be I don't know about taught about loss and grief, but they should certainly be aware of it. And A lot of students don't have to actually lose a loved one or someone close to them, but they could show signs of grief from moving or a divorce where they grieve the presence of a different person. And the younger children don't quite understand the finality of death, but they will still grieve for that presence as well. Teachers should not press daily activities on grieving students because it could make matters worse. They should just encourage the students to do things that will make them feel better, such as write notes to a person who may have passed or get support from other students.